Well, when it comes to endometriosis, there are some common misconceptions and causes regarding treatment options.
Joining us today to help us approach misinformation head-on is 9 News medical expert Dr. Payal Kohli. So let's just start here. What is endometriosis and why does it happen and who does it happen to?
Yeah, it's very common, ladies. 10% of women will get endometriosis, chronic inflammatory condition. So if we think about how we have our period, do you remember back to sex education?
Oh yeah,
so essentially,
fifth grade.
Is it? Yeah, I think mine was 5th grade too. So what happens when you have your period is the estrogen builds up the lining of the uterus. The progesterone stabilizes it, waiting for a pregnancy. If you don't get pregnant and you don't have an implantation of a fetus, then it sheds the lining. And that lining is supposed to come out through the vagina. Now, a lot of women will have something called retrograde menstruation, where the period flows backwards into the pelvis because our fallopian tubes are not attached to our ovaries, they're separated. And then you can start to get uterine tissue implants. So this is the leading theory as to what causes endometriosis, is your backwards flow on your period, essentially causing pieces of uterine tissue to get stuck inside your abdomen. Now, that doesn't explain everything because we know some women with endometriosis will actually have implants in their lungs, which is on the other side of the diaphragm. Some will have it in their brain even. So we think there's something genetic, hormonal, inflammatory on top of this retrograde menstruation that causes endometriosis.
I had never heard that definition. I'm glad you said that and clarified, but I know there's still a lot to learn. What about some of the myths that you want to debunk?
Yeah, so I first want to start with, most people think endometriosis only happens when you have your period. So it can flare during periods because that's when the hormonal cycle is the most active. But if you think about it, you implant pieces of uterine tissue all over your belly. It can be on your bowels, it can be on your bladder, it can be on your diaphragm, it can be on your back. So you can have pain during intercourse, you can have pain during urination, pain during defecation or moving your bowels, back pain, fatigue. So it can really be a chronic disease that affects the entire body and happens all the time.
And it's so great. My best friend in the world had endometriosis that ended up in her lungs,
Really?
causing issues. She was
Yeah.
hospitalized for like 3 weeks. This is a very healthy, active woman who was literally hospitalized with lung issues. It's incredible how it can affect the whole body.
I mean, it's debilitating for the women that have it, and they actually stage it. You can have up like stage 4, depending on how many implants you have and how severe they are. But here's another myth, is that every woman with endometriosis is going to have pain. So here's the thing we can't figure out about it, because there's some women who have mild disease who have severe pain, and then other women who have implants everywhere and they don't find out until they go for a fertility evaluation, and the fertility doctor says this is why you're not getting pregnant, is because you have endometriosis. So that's a tricky thing we still haven't figured out. Why is it that some people, like your friend Alex, feel so much pain and others necessarily don't?
So what signs should women look out for? Are there any?
There are, and these are really warning signs that you have to be very careful to look out for. So if you have pain during intercourse, and I'm talking especially after menopause, that's something to talk to your doctors about. But even before menopause, if you've developed any kind of pain during intercourse, if you have period pain so bad that you have to stay home from work, that's not normal. That's not how our body was designed and evolved to be. So you may be starting to have some endometriosis or some other menstrual dysfunction. And of course, if you have pain during some of those other things I talked about, moving your bowels or urinating, that's never a good idea. Now, a lot of women think that after menopause, endometriosis just goes away. But again, those implants are still outside the uterus. So even after menopause, you can essentially have endometriosis persist. And same with pregnancy or hysterectomy. So sometimes they'll treat endometriosis by just taking out the uterus. But what did I say? There's implants all over the body. And so taking out the uterus doesn't fix the problem. You can't really debunk a lot of those implants. And sometimes they'll go in and actually try to take out some of those implants. Women will have a big abdominal operation. And then pregnancy can make it better in some women, but worse in some women. So it's a debilitating disease, really, really common. There's no cure for it. Pregnancy and hysterectomy won't do it. But I want to raise awareness of it so that more women can know, if not just a really bad period, this could be something more.
More conversation, certainly. Dr. Kohli, thank you for having that with us today.